This program is presented by University of California Television. Like what you learn? Visit our website or follow us on Facebook and Twitter to keep up with the latest UCTV programs. Also, make sure to check out and subscribe to our YouTube original channel, UCTV Prime, available only on YouTube.
We'll start off our discussion. Janice is the director of Zero Breast Cancer, and she's the lead of our community outreach translation corps here in San Francisco.
Well, this is the first time I've been a respondent or discussant. But I'm delighted to, so I'm not quite sure what that role is, but I'm delighted to be able to speak this afternoon, and I want to let you know that I'm a proud graduate of a 2-hour improv class that was held yesterday that many of the people in the audience participated in. And one of the tips was, if you want to gauge the audience, is that you pick out 2 people in the audience and fixate on those 2 people. And they should be head nodders. So you want somebody who nods yes all the time, like you're saying something really important, and then somebody who's nodding off. So when I've been sitting up here, I have designated my 2 people, so I can now proceed. Well, I have been very honored to have been part of the Breast Cancer and Environment Research Center since 2003, and during the first 7 years, it focused mostly on onset of puberty as a window of susceptibility. And so I was absolutely delighted when the programs were expanded, and that as part of this program, we were adding, a session on pregnancy-associated breast cancer. And while I was in the puberty, meetings, often Dr. Biro would say that 85% of women can identify their age of menarche, which is a risk factor for breast cancer, within 6 months of the actual time. So without looking at the research, I would suggest that most women who have had a full-time pregnancy can identify 100% of the time the date of their delivery and their number of children. And I don't think there's anyone here in the audience would argue that pregnancy is a time when there are tremendous changes and growth, and also differentiation that occurs, and that it truly, is a window of susceptibility, not only for just breast cancer, but for a lot of women's health issues. And just to kind of go through, briefly some of the just amazing things that happen, one is that circulation doubles, cardiac output, the heart doubles, blood sugar goes up, cholesterol goes up, fat is stored, whatever cells that store fat increase. And of course, it's also a time, when lots of women, it's the first time they've really gained significant amounts of weight within a short period of time. So all of these things, as Melissa pointed out, kind of interact with, breast cancer risk in the end. And then, of course, women are exposed to like a sea of hormones during this period of time, both progesterones and estrogens, and many different kinds of estrogens, some that, non-pregnant women are exposed to. So I'm afraid, I'm sad to admit that really after being in this field as an advocate for 15 odd years, what I always thought about was breast cancer. I did know that having a first full-term pregnancy at a young age, confers, lowers your future risk for breast cancer, is protective of breast cancer. Of course, that age changes a lot. Sometimes it's over 31, sometimes it's over 30, sometimes it's 24, which is sometimes confusing. But I did know that, and I did, know several theories. I know researchers have been studying, and particularly Jose Russo, for many, many years to kind of explain why there is a protective component to having a full-term pregnancy at a young age. And as Dr. Russo's research has shown, that pregnancy results in a differentiation of the breast, reducing its susceptibility to carcinogens. And today, when he presented, I kind of talked to him briefly yesterday. He's kind of drilling down on that. I don't know if you call it a hypothesis or that theory. And today, presented, research identifying, what differentiated associations, associated molecular changes, or the genetic signature, how those persist over the lifetime, until menopause. What I was really not very familiar with until I, heard at another conference, actually, these same people speak, was that there is also, a significant short-term risk for breast cancer that is pregnancy associated. And I had, heard or read in the paper, obituaries, of women who had delivered and had pregnancy-associated breast cancer and died, when their infants were 8 months or 10 months. And I always kind of thought it was a very, very rare thing. And also I always kind of felt, that there was, just, maybe a year or two when women were at risk. So this is, a concern in some ways to me, and I'm sure to other women. So I'm not sure, as Melissa said, how you convey that, that message, that public health message, in a way that isn't frightening to pregnant women. I have 2 minutes. Okay. So I guess my other comments are, I think clearly, and I think what Dr. Troster added was, the knowledge of looking at breast cancer risk in pregnancy-associated breast cancer by specific subtypes, which is something that the advocate community is very interested in, and also the role of environmental factors, so not just endogenous, but also some exogenous factors that might affect breast cancer tissue. So I think there's a need for continued research on identifying clinical events during pregnancy that confer risk protection in order to better understand the mechanisms, or perhaps eventually design a preventive approach for women. Clearly, we need increased knowledge of which young mothers are at risk for postpartum pregnancy-associated breast cancer, which seems to be a continual problem in breast cancer. We have difficulty predicting who's going to go from DCIS to invasive breast cancer, and what women are going to go from invasive breast cancer to metastasized breast cancer. So that's an important area. And then in talking to Dr. Troster and Nisha Graves, they pointed out that this pregnancy, this window of susceptibility, is an ideal time to communicate public health messages and health education messages, because most pregnant women, this is a period of time when they do readily and eagerly alter their lifestyles and are very eager to know, what they can do to ensure a very healthy outcome for their children. And it's also a time where, they also begin looking more at their health, because they want to be there when their children grow up. So, and also during, Nisha pointed out, during postpartum breastfeeding sessions, that's another really ideal time, I think, to deliver, breast cancer prevention health messages. So thank you very much, and I think we're going to, so if you have questions, I'm sure people have lots of questions. It's a very interesting session.